Hi, it's Dr. Campbell again. I'm here today to talk to you about a syndrome called Guillain-Barre syndrome, or GBS for short. The last time we talked about peripheral neuropathy in general, which is something that's not a medical emergency, but something that you need to get checked out quickly to prevent further progression. Guillain-Barre syndrome, however, is a medical emergency. It is a type of neuropathy that rapidly progresses over days to weeks. The way this syndrome presents is with weakness in the arms or legs, typically in the legs, that progresses over days to weeks. Or sometimes it will present with sudden onset or progressive tingling in the extremities or hands and feet that will start to gradually come up the legs and up the hands. If you have something of this nature and it develops over days, you need to seek medical attention immediately. The reason is that general neuropathy, like we discussed last time, is something that progresses over months to years, and it's not something that is particularly life-threatening unless you have a severe form that starts to cause falls and other complications that can result in injury. With the Guillain-Barre syndrome, however, so many nerves are involved and the progression is so rapid that it can affect one's ability to breathe because the nerves that go to the diaphragm won't work properly. What we look for on exam would be a couple of things. One, we're looking for signs of weakness, which may not be the initial presentation, but we also look for absent reflexes. So I don't know the last time you had your knee jerks checked in the medical office, but that's something that we check because with GBS, these are typically absent or depressed. Once we hear the story about what you're experiencing and have an exam that's consistent with Guillain-Barre, there's subsequent testing that has to be performed to confirm the diagnosis. The first test we do is something called a nerve conduction study. With that test, we can tell if there's something wrong with the nerves. If this test is consistent with Guillain-Barre, the second test that we do, and you can do them in either order, is something called a spinal tap or lumbar puncture. And what we're looking for is an increased level of protein in the spinal fluid. This is often done in a hospital setting because, quite frankly, once we get the history and that we complete the examination, most of the time we know that we're dealing with something like Guillain-Barre, and because it progresses so quickly, we're typically putting it in the hospital and doing the evaluation in the hospital setting. I remember the last time I had a patient with Guillain-Barre. He was a farmer, and he came to me after several days of having a tingling in his feet. His exam was otherwise completely normal, but I was able to take him across the hallway, complete the nerve conduction study, and he ended up having to be admitted to the hospital that day. Needless to say, he was very surprised because he wasn't expecting to go into the hospital, but he had to call his wife, get his bags packed, and I put him in. Now, in the hospital, these people are typically not appropriate for a regular floor. They need to be closely monitored. What we're looking for is their ability to breathe properly. We're looking for their blood pressure. We're checking their heart rhythm because Guillain-Barre can affect all of these systems. It not only causes weakness and numbness, but it can also affect the nerves that control our ability to breathe. It controls the nerves that affect our esophagus and our colon. So one of the complications of Guillain-Barre syndrome can be something that doctors call ileus, which just means that the colon itself is basically paralyzed and it doesn't work properly. There can also be something called urinary retention, where your bladder gets very, very full, but you're unable to empty it without assistance. There are lots of other complications that can be associated with the Guillain-Barre syndrome. One could have significant facial weakness. This patient that I just made reference to had what we call facial diplegia, which just means that the muscles of the face are weak on both sides. He had so much facial weakness that he wasn't able to speak, so we had to use other measures to communicate with him. There is treatment for the process. The two mainstays of treatment are one, something called IVIG, which is intravenous immunoglobulin, and the second one is called plasma exchange. These treatments will reduce the severity and course of the disease process. So what we'll have to do once we think that this is something that a patient has is call your insurance company and request permission to use these types of treatment. Luckily, this is something from which one can recover if you're admitted to the hospital and you get adequate supportive care, because the mainstay of treatment is supportive care and getting the medications as quickly as possible into your system. The progression typically lasts anywhere from 2 to 4 weeks, after which you probably will have reached your peak, and then it takes another several weeks to recover, if in fact only the coating of the nerve is damaged. Occasionally, however, it can be more aggressive and the nerve itself can be damaged. If this is the case, one may have some residual weakness because of the Guillain-Barre. In most cases, however, it's a one-time thing. It's rare for someone to have another episode of Guillain-Barre syndrome. But the point of this whole talk is for you to recognize the symptoms and realize that it's an emergency. If it develops quickly over a matter of days, it's not something you want to wait to see if it gets better. Call your doctor, because you may have Guillain-Barre syndrome, and that's something for which you need to be admitted not only to the hospital, but likely to the intensive care unit. So thank you again for tuning in. I hope to see you next time on The Empowered Patient.